Do you have clients who come in to see you who are very resistant to a treatment plan? Have you ever wondered what's underneath their resistance? Well, in today's podcast, I speak with Dr. Mary Lauder, an osteopath and integrative medicine specialist from Michigan, who has been helping clients crack the anxiety code to improve their own health and well being. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this episode. I am super excited to introduce you to Dr. Mary Lauder. Mary is a doctor of osteopathy. She is living currently in Holland, Michigan, and she used to live in Longmont, Colorado, where I live, and she had a practice in Boulder. And I met Mary on her podcast, listening to Since You Put It That Way is the name of her podcast. And she speaks so similarly to the way I treat. And I just had to get you on the podcast, Mary. So welcome and thank you so much for being here.
Oh, yeah, thank you. Thanks for having me. It's always great to talk amongst friends and kindred spirits.
Yes, that's exactly how I felt when I was listening to you because I'm like, my heart just warmed hearing you talk. And the podcast that really got to me was one of your colleagues that you guys both went to University of Michigan. Is that correct?
University of Montana, maybe?
Montana, okay.
Yeah,
Well, anyway, you were talking to your colleague, and you guys were just talking, like, my language.
yeah, yeah,
So,
yes.
I would love to know, how did you get to where you are today in practicing in the way that you are today?
Yeah, that's a great question. Well, if I answer it like Bugs Bunny, I would say I turned left at Albuquerque, right? So that's always me, the Bugs Bunny said. But there are a few stops on the way as well. So,
Yeah.
well, I always wanted to be a doctor. I loved it as a child. And I looked at the encyclopedias, the childcraft books, things that my parents bought for us. And my mom said, well, what are you kids going to do after high school? And we're like, I don't know. She goes, you're going to college. So at a very young age, she just instilled that in us. She goes, that's just next. And then her follow-up statement, as if she needed one, was, and you're going to pay for it yourself. So
Oh,
so there were some very, very straightforward parameters that I bought into as a child. And the thing was, I never stopped because I went from undergraduate to graduate school, then to medical school, then to residency to, so
yeah.
I didn't get the memo that I could stop, or nor did I want to stop. I love learning. I'm curious. And
Yeah.
I've been that way my whole life. And I've always, as I've come to understand myself now, being older, I always was the curious child. I
Mm,
always was the one that says, well, why does it wasn't like the why kid, because that's like annoying. It was like, I wonder if we should
yeah.
think of this. So at a very young age, I would come up with things, and my parents, I'm sure, well, I know they were a little exasperated with me. And they're like, seriously, can you just, I'd be like, I don't know. This is just, are you, and it was always like, Mary, Mary, you're quite contrary. And I'm like, actually, I'm not, which is, a contrary statement. But it was, no, I just see things differently.
Oh my gosh, I raised one of those children, and they're exhausting.
Yes.
But I
And I never really got into trouble.
yeah,
Um,
yeah.
and I knew parameters, and I, knew how to behave. I mean, I tried a few things and no follow-up questions there. But, it was great growing up. I lived outside. What do I mean when I say that? Our backyard backed up to fields and woods and old Michigan, what we called old Michigan basements, which were dugouts with rocks built in.
Oh,
They were
wow.
great camps, play areas,
Sure.
right?
Yeah.
And we had this one area that I'm sure used to be a homestead,
Oh,
and it had these big lilac bushes. And every spring I would just go out and lay down in the lilacs, and I would just spend my entire afternoon out there.
I love the smell of
Yeah.
lilacs.
Yes.
Yeah.
Yes, and I have some in my yard now,
Yeah.
a number of big, shrubs and bushes, and I just always connected with nature,
Yeah.
and I was just always outside.
Mm.
And so, when I went off to college at the University of Montana, I met with my advisor, and he said, we took a test, and he goes, "Well, you should be an osteopath." And I'm like, "No, they're quacks." And and it
Why did you
was
think that? Why did you think that?
yeah. We had a very unfortunate event in our family where I lost an aunt to from a medical
Oh,
accident, a
okay,
medical mistake,
okay.
and the person leading that case was an osteopath.
Got it. Sure.
So our family
Yeah.
being relatively tribal,
Mhm.
um, just they were quacks. And so, and I know I just remember the look on his face to this day. It was like, oh my gosh. And so I went through undergraduate. I did athletic training, physical therapy.
Oh, okay.
I did not get into physical therapy school. They said I was not physical therapy material. Thank God, because I never would have been a physician probably, or I would have had
Right.
more debt going back to being a physician, right?
Yeah,
And
yeah,
so, and my best friend's physical therapist. I've known her for 40 years.
yeah.
Met in physical therapy school, and so then I went into spinal biomechanics at
Mhm.
Michigan State because I love the spine, and it was just fascinating.
Yeah.
I didn't really know that they had an osteopathic college there at Michigan State. And
Ah.
when I saw that, I'm like, oh, that's what I want. And then I'm like, well, wait, they're quacks. And I'm like, well, maybe they're not. And so then I researched out the founder of osteopathy, A.T. Still,
Uh-huh.
who was right in the Civil War, post Civil War era, and he was a mystic. And
Really?
I read his, yeah, he was a mystic. And so I read his books, and I'm like, oh, I get this guy. And I thought, I might be a mystic. Now, at that time, mind you, I was steeped in religion, organized religion, that
Yes.
was way far on the other side of what I was reading.
Yes.
And I'm like, oh. And it brought a crossroads for me.
Mhm.
And then I had to deal with my family about being an osteopath. And
Mm.
so my
Yeah.
uncles, who are very tribal, sat me down as why you want to be an osteopath. And I told them, I said, because it's the only way to think it, the body heals itself. I believe in that. And I want to do osteopathic techniques. And I said, I just think this is the way I want to go. And it's right here in Michigan.
Yeah.
And so they reminded me they were quacks, to which by then I was old enough to hold my ground. And I said, well, when
Yeah.
I was 12, you all remember I almost died from an appendicitis. And the doctor misdiagnosed me. That was an MD.
Right.
So where are we going with this, Uncle?
That's a good argument.
Yeah. And so I'm like, so either everybody's a quack or nobody's a quack, or the quacks are, individual. So, or the quacks are just in the sidewalk, right?
Yeah.
Something like that, right? So I was like, okay, okay.
Uh,
So I went, and then when I started studying, it made so much sense.
mhm.
And, the body has the inherent capacity to heal.
Yeah.
Structure and function are inherently related.
Yeah.
And understanding and applying those tenets is what allows you to make solid and sound medical decisions. And I'm like, yeah, I'm just all in.
Yeah.
So then you get into medical school and you're like, great, I'm going to be a doctor, but then you have to figure out what kind of doctor you're going to be.
Mhm.
And like, oh my gosh, existential crisis again, you know. And so I was going to be a surgeon. I was going to be orthopedic surgeon because I love bones and I was really good at it. And I had a lot of experience at it in my training as to how my training went. And I just kept getting put in the right place at the right time to get extra training in this. And I excelled. And I was a woman in a very strongly man's world, and it annoyed me.
Yeah.
And so I did what anybody could do. Not really, that's a joke, but my professors set it up for me to go to Europe to study. And I
Really?
went to Switzerland. Yeah. And because of I worked a lot with my osteopathic mentors, like Dr. Phil Greenman, who wrote one of the first textbooks, Dr. Fred Mitchell, Dr. Lon Hoover, um, and And so working with these, giants in the field, I skipped class sometimes. And I'd go and I'd work with them in the clinics, especially Dr. Greenman. And so it was wonderful. And I learned so much by just
Mm.
following them and shadowing them and talking with them and hanging with them. And then I also was a graduate student in medical school and helped in those programs as well in those classes. So they thought it was a good idea that I should go to Europe. I thought, why not?
Yeah.
So my last year of medical school, I spent 3 months in Europe. And it was something that was transformative because I lived in a farmhouse outside of Zurich with a family. And I
Oh,
would take the train in every day to Zurich and I would do surgery and I would examine patients and I would use my really minimal German, Haut German, and do the best I could. And then after a month of that, they said, "This is really good, but you should go where there's no restriction. Why don't you go to England?" So I could speak British English much better than German,
what did they mean by no restriction?
language.
Got it. Okay.
So in,
Yeah.
in Switzerland, you're kind of linguistically
Yeah.
isolated,
Yeah.
a bit culturally isolated.
Yeah.
And what that did, as I lived in that farmhouse, it allowed me to spend a lot of time alone, but I
Mm.
wasn't lonely. It was time spent really in being and in presence and
Wow.
learning to sit quietly. And that's what allowed me to make decisions to come out of a more organized sense of religion into
Okay.
more of my spirituality.
Nice. Nice.
And then I also realized I don't want to be a surgeon
Yeah.
because a couple reasons. One, you're up at night when everyone else is sleeping because nothing good happens, before midnight. It's all after midnight when
Right.
all the action happens. So you're up, you're tied to a system because you need the OR.
Yeah.
And if I wanted to quit being a surgeon, what would that look like to rebuild?
Yeah.
And so all those things I took into strong consideration of absolutely loving being in the OR.
Mm. Yeah.
And I thought, so as I sat with it, and what I learned was, and this was another life changing thing, is perhaps I was a surgeon before.
Ah, yes. Yes.
And
I
what I was doing was tapping into that.
yes.
And do I need to do that again?
Uh-huh. Yeah.
And so I realized, well, what if I've been there, done that, got the t shirt, right?
Yeah. Mary, I just want to interject for those people listening in. Mary's
Yeah.
talking about past life,
Yeah.
that maybe at some point in another lifetime that she was a surgeon. And Mary, I believe that I had multiple lives as an OBGYN.
Yeah.
And
I
I
can see
believe
that.
I
Yeah.
believe my work, and there was something that got spark that got lit when I had my first baby, and I was like, "I need to do this."
Right.
But
Right.
it wasn't until 18 years later that or yeah, 18 years later that I was like, "Oh, no, it was 8 years later that I got into doing pregnancy postpartum care." But
Yeah.
and to be fully transparent here, I believe in karma and
Mm,
that maybe this lifetime is clearing away possibly all the damage that I might have done in those other lifetimes as an OBGYN.
mhm.
I'm
There
I'm doing
certainly
the
are lessons that we
healing,
learn, isn't there?
right?
Yeah.
Yes, yes, yeah. So
Yeah.
thank you for saying that. I love it.
Yeah.
Yeah.
So then, the next best thing was family practice because I
Mhm.
could do anything anywhere at any time.
Yeah. Yeah.
And so I saw freedom in that. I saw, an unrestricted license. I saw that I could get trained to do anything. I saw that I could bring that into my practice and I could just be who I was.
Mhm.
And I always saw who I was as someone who worked one on one with patients that really dug deep, really listened deep, and came up with accurate answers and creative ways to treat.
Yeah.
Okay, so about the same thing, 25 years later, I'm through the different systems, done different iterations in my career, and I'm doing that in Boulder, pre-pandemic.
Right.
And I've got an overhead, which, when you do medicine, the margins are slim. Yeah. And I'm doing that and I'm relatively happy, but it's just like the clinic feels like an albatross. But I'm
Mm,
like, I don't know what else to do. And it was just a little early for the all the virtual stuff because we weren't ready for it.
right. Yeah.
So the pandemic comes and just obliterates my practice.
Mm,
There
y-
was no saving it. And there was no way to get in front of it to save it. And there was nothing to do. And it came on the heels of a huge season of grief because I
mm.
lost both of my parents.
Oh,
Late
wow.
2018, my father, and early 2019, my mother.
Wow.
My father was expected to pass because he was ill, but not my mother.
Oh, wow.
And it, yes, when you look astrologically, it aligned with different comings and goings and returns
Yeah.
and all of that. But what I know is that it nearly killed me to lose my
Wow.
parents in the way that I did.
Wow.
And then when COVID came around, I got COVID before it was a thing.
Okay.
Early March
Yeah.
2020, before the lockdown. So I had a patient who came back from Italy with the
Oh, wow.
weirdest bronchitis I'd ever seen.
Wow. Yeah.
And and I was up at Vail giving a lecture, 9,200 feet, and I
Yeah.
couldn't breathe. I'm like, this is weird.
Yeah.
And so then I said to my husband, we should go home. Okay, let's go low. Yeah, 5,000 feet, right? In Longmont,
Yeah.
right?
Yeah.
Okay.
Yeah.
And so I spend a night there and I'm like, I still don't feel good. And so we go to the hospital just down the road, on the corner of County Line there and Highway 119.
Yeah.
And they go, do you realize your oxygen level 76? I said, had I known that, don't you think I would have led with that?
Yeah. Right?
So, so I get hospitalized in isolation, and then they start talking this COVID thing. And I had the whole thing, the ground glass appearance, I had the abnormal labs. I didn't need to be intubated and
Oh, thank goodness.
probably would have refused it, to be honest, because I
Good.
knew I didn't need it. But it took a long time to recover from that. And that was, my initial
Yeah.
experience with that. And I think why that occurred was the level of grief that I was handling.
Yes. Yes. Well, we know grief attacks the lungs,
Right.
right?
Exactly.
And that's where COVID part of it. Yes. Wow.
Yes.
Yeah.
And so through all of that journey, it just made me look because things were wiped out again at all levels. It caused me to pause again and
Mhm.
say, what do I really want to do?
Yeah.
What's left to do?
Yeah.
Because at that time, I was in my late 50s. And I'm like, I could retire and do something totally different,
Mhm.
or I could really figure out what I think I'm really meant to do that I haven't yet done and do it.
And what was that?
Be an intuitive doctor.
Whoa. So tell me more about this because that's gotta be a big crossroad, Mary. I mean,
It was.
to relate to that, it's taken me a long time as a physical therapist to
Mhm.
claim to be a healer.
Yeah,
I'm imagining it's the same journey for you.
it is. And so what would happen is throughout my entire career, I would go into an exam room and the patient would start telling me things and I would hear it differently and then I would see what they had. I literally saw it.
Visually in your mind's eye
Mhm.
kind of thing? Yeah,
In
okay,
my
love it.
imagination, like, oh, they have
Yep,
this, they have that.
yep, yeah,
Oh, we should check that lab. Oh, no one's considered this. We should, and I got in trouble in my training for being too chatty. And I remember one of my internal medicine doctors say, "You're a really good physician, but you're chatty. What is that?" And I go, I I said, "I think it's just me," but what he goes, "But you always come up with what's going on with the patient." I said, "Well, yeah, because I chat with them." So
Because they actually tell us what's going on.
exactly, if you listen to them, they'll tell you what they have.
Right?
Exactly, which that is actually on my wall framed. If you listen to the patient, they will tell you what's wrong with them. Sir William Osler, right?
Yes.
And so, yeah, and so that was and when in doubt, go back and reexamine the patient and ask their history again,
Yeah,
and then and then you will know what your next steps are.
yeah,
And so that has never failed me.
right.
And so what I understood that to be was a deep intuition that using my trained skill, I developed to be quite keen.
Yeah,
And so I sometimes didn't know the answer of what was next, other than, okay, I need to go look this up and research this out. But then we would have the next steps.
yeah,
Oh, this type of specialist, or no, actually, really, it's this way with these tests, then we consider that. And so that's how that type of clarity occurred with my patients. And they'd be like, so then they would, come, they're like, yeah, go see my maiden name was Mark, go see Dr. Mark, she'll figure it out. So they would just like, my friend said to come because no one can figure this out. So I'd send my patients to specialists, and they'd come back and they go, specialist doesn't know what to do with me. So you're gonna have to figure it out. I'm like, ah. And so, we would go back to the history and the exam, and then that opened up actually the integrative holistic world so much more
mm,
because
yeah,
I needed more tools.
yeah. Mary, can I go back to your intuition? I'm
Yeah.
curious, you said you saw what was going on. Seeing is one aspect of our intuition. I tend to be a knower. Like I just know what I need to do. I'm
Mhm.
curious, have you, and over time I've developed the hearing and some seeing. Seeing is probably my weakest, but I hear a lot of words
Yeah.
and I just know. I'm curious what your intuitive process or way of getting information, what's strongest for you?
Yeah, that's a great question. I think we're wired similarly. I think I'm a knower because you just know.
Yeah, yeah. Yep,
And then I hear things, and it's a word, it's a phrase, it's a
yep,
think of this, or
yep.
and then the seeing is like it's just like it's a sparkle. I don't see auras.
No, I
I
don't
don't
either.
see aberrations.
Mm-mm.
I don't see I need glasses, so I don't see very clearly without
I have contacts, so
Yeah.
yes.
Yeah. No, it's a matter of, I don't, and I don't and I learned to go read auras and that, and I was like, "That's kinda boring." Sorry, I thought it was, and I know, my apologies to everyone who excels there and loves
And
that,
yes, yeah.
but it was just wasn't it was too slow for me, it was too methodic.
Yeah, yeah,
And the answers are there when you read it that way, for sure.
yeah,
Um, but I'm a quick start, I'm, a rapid think processor, and I can leave the details for someone else to do. So
yeah.
I think that's how it sorts out that way. Yeah.
So in my practice, I'm a physical therapist and
Yeah.
my hands are
Physical
always on.
emphasis on word.
Right,
Physical. Yeah.
right? Yeah, but my hands are always on the body until one day, my hands started floating above the body.
Mhm.
I'm like, "What am I doing?" But I trust my hands, right? I've learned to trust my hands,
Yeah.
and so I'm like, I have no and my PT brain is going, "What the heck is going on here?"
Right.
I don't, like, because at the time, I wasn't quite sure I was really feeling anything, and
Yeah.
over the years, I've definitely can feel the energy in my hands, and I've now come to realize that it's the subtle bodies, we
It
have
is.
energy bodies that surround our physical body and
Yes.
emotional bodies and all the different layers of it. And
Yeah.
I'm clearing that away. And so,
Yes.
but at the time, man, my PT brain was like, I got to figure this out. I got to figure out what I'm
Right.
doing, right?
Right.
And so I went and I took a Reiki class. And so I'm
Hmm.
like, okay, this is great, but no, that's not it. Like I
Yeah.
just need to trust. And
Yes.
yeah.
Yeah, I think that that's true. And so when you understand, the Germans have a very good article out on the biofield, which
Oh,
is really basically they're scientifically describing the aura.
Okay.
And
Wow.
so as I've evolved over time, as I create or connect the biofield with my patient.
Mm.
And so then there's an absolutely open transfer of information back and forth that, like, for example, recently I had a patient say they came in as a new patient and they have something that most likely will require imaging and a biopsy. And they're, before they even put their purse down, the individual said, I refuse to get a biopsy. I refuse to do. And I said, so then I just, note, please let the chart reflect patient speaks in absolutes, And so in saying that to the patient, we all had a chuckle. Yeah. Um, but what that also did was kind of put that part a bit on notice,
Mhm.
hearing, that, okay, well, we're going to find the best way forward together. And so a person can use their intuition to guide the conversation.
Mm.
And in medicine, what happens is if a patient comes in and says that, the doctor, the provider gets their R up because it's their ego and because they're busy and they're, answering phone calls and charts and, a million things are pulling on you. And they go, well, fine, if that's how you're going to be, fine. Then what am I going to do for you? I'm not going to do anything. And so it becomes antagonistic.
Yep.
And tell me that that's not happening in our medical system. And I'll say, I don't know where you're going because I want to go there too. You know,
Right. Yeah.
so I
Yeah.
could say that where that's not happening is my office, right?
Right. I love
So I
that.
go there, right?
Yeah. Yeah. Yeah.
So then that's the thing. You use that and understand. And then as you drive and direct the conversation, you figure out what happened.
Yeah.
99% their anxiety that they come with is driven by a traumatic event.
Yes. Yes.
And
Yes.
and
Yes.
so then what I learned was if I could figure out how to deal with medical anxiety, I called it, or going to the doctor anxiety, and I looked at like the remission rate of depression, which is 30%. If I was a surgeon, I said, well, my success rate is 30%. I would be like, I would expect everyone to run the other way.
Right.
30% is not that good,
No.
right?
No.
But we
Yeah.
settle for that when we treat mental health and mental illness, depression, anxiety, by the ways we're doing it currently.
Yeah.
And so when I looked at all of that, and everybody, the majority of people that would come to see me had this anxiety, I had to figure out what to do.
Yeah.
So that's where I put my intuition together regarding anxiety, regarding the chronically ill patient, because I treated them holistically by using IV therapy, ozone, oxidative therapies, high dose vitamin C, supplementation, functional medicine testing, nutrient supplements. I mean, everything. I did everything. And I would have some people that get like 75% better, but we couldn't get them to turn the corner.
Mhm.
And I knew it was emotional, but I didn't know how to go there. I
Yeah.
I didn't know how to go there.
Yeah.
Or you've got the folks that do everything right and they're afraid of doing something wrong, the orthoexias, right? They're doing literally everything correct. Their yoga's perfect, their diet's perfect,
Yeah.
and yet they feel horrible and their relationships are in turmoil. And all, and I'm like, there's a huge disconnect.
Mhm.
So I started to study trauma because I also had some from how my parents passed, especially my mom,
Yeah. Yeah.
and what her experience was. And what I learned was that all trauma causes us to disconnect from our body
Yes. Yes.
and from ourself, capital S, small s, from ourself.
Yeah.
In the psychology world, that's called dissociation.
Mhm.
And anything and all things, there's a continuum. So there's not an absolute, it's kind of like it's pretty much the bell-shaped curve. Thank God we have that, right?
Yeah.
So it's somewhere in there. And then what I learned was the way back to safety was to come back into connection with yourself. And that being in connection with yourself is going to be the most safe place to be
Mm.
because from there you can go anywhere.
Yet, a lot of the trauma that is occurring to people is causing them this disconnect. It doesn't feel safe. So the trauma makes them not feel safe. So that's why the disconnect happens. And so there is this nuance of like trying to help them to feel safe in their body again to allow that reconnection to happen.
Right. And there's the neurology of it, because it's somewhere in the sub-unconscious
Yes,
and
yes,
conscious.
yes,
And if the body has the inherent capacity to heal, it should be able to heal this too, right?
yes, yes.
Okay. Right. So we're working on all those premises. So traumatic event causes trauma in the body, which causes us to disconnect. So that long tether of disconnection, some people are closer, some people are farther, some people it's, like a bungee cord, some people it's more of a rigid pole. It looks all different shapes for folks. And the behaviors go. So then I said, well, what are these behaviors?
Yes.
Okay, well, if we understand the emotion, we're going to understand the behavior, the backstory, the biology, and the biography of that emotion. Thank you, Brene Brown, for bringing that to our attention through her book, The Atlas of the Heart, and
Mm.
her work in emotions, not just vulnerability, but knowing that we need more than three emotions. If I gave you three emotions and said, we're taking you to Disney World, and you can tell me about your trip with three words, only three words, happy, sad, and pissed off. How was your day? Well, I was happy.
Yeah.
What about, Magic Mountain or Splash Mountain? Happy. Meanwhile, you're screaming your brains out, having a great time, and you literally, so it limits your experience. The more you have language to understand your emotions and can name emotions,
Hmm.
the richer your experience.
Yes.
So then I thought, well, if you're out here and behaviors are part of the emotions, what if we named the behavior? What if we name the emotion you feel when you have that behavior? Maybe we find it where it is in your body, and then we find out why you do that. And then I came across Brene Brown's work on this. And I'm like, okay, I'm in the right park. I'm in the right,
Yes.
yeah,
Don't you love it? Like you're tapping into that collective consciousness
yeah,
of
the
of
vortex.
the vortex. Yes,
Yeah,
I love when I interview people and they're like across the world and we're doing the same things and we both
yes,
discovered it on our own. You know,
yes, yes,
it's so
yes.
cool.
So then I took that and developed a course called Self Compassion and Connection, based upon Brené's work, Understanding the Emotion, based upon Gabor Mate's work, Understanding Trauma and Disconnection,
Yeah.
based upon some work of Asha Clinton, who did some energy work, kind of like tapping, but differently,
Hmm.
and then based upon Kristen Neff, who's in self-compassion work.
Yeah.
Because what I found when I created this biofield by saying a certain statement, it became a sacred container, as it were, of safety, that we could look at things, whether they occurred or memories we didn't know that we had, that
Hmm.
had resurfaced. But if I'm there with you and holding safety, we could explore things
Yeah.
without having to go back and feel it.
Yes. Or re-experience the entire
Right.
event again. That it does not need to happen for healing everybody.
It's not. It
No.
does not. And so we presented the edges like this to the nervous system, like a zipper, the base of a zipper. I mean, you don't watch the zipper come up, right? You start it, you keep chewing gum and walk away, right? Put your hand
Right.
up,
Yes,
right?
yes.
So, but the zipper is going to function a certain way. So if the nervous system functions a certain way, the autonomic nervous system and the midbrain and all the things that we know for healing of trauma, because the statistics show that if out of four people who get traumatized, three will recover.
On their
One,
own.
yes, with resiliency, with support, with resources, with consternation, with their constitution, with, okay,
Yeah,
well, that's how it went. We'll do it different. Yeah,
yeah.
that's the statistics. Yeah.
Well, and I would guess that those people who have more resilience, have less history of trauma or more stability from their history than maybe those that don't?
Mm-mm.
No?
No, that's a great, I love that. I love that you did that. No.
Okay.
Yes. Perhaps. It really is all of the above because, you heard the old phrase because of or in spite of, right? You're
Yes,
gonna turn
yes.
out a certain way. And some people that and I think it's where we are in our planet, I think it's where we are in our evolution of consciousness, that some of the folks that are coming forward as healers have had a horrendous,
Yeah.
horrendous amount of trauma,
Yes.
and they have just had to figure it out.
Yeah.
And to quote the therapist that I have used for a significant amount of time doing gestalt work and presence work and somatic work, boy, Mary, you've had more than your share of trauma.
Mm, yes. Yeah.
And 30 years ago, when I became a physician, I did a lecture in Grand Rapids, Michigan on stress in the body.
Mm,
It was a sellout. We had like 300 people in the crowd. I'm like, that was like unheard of.
yeah.
And I'll never forget the comments that came back. There was a few and they were kind and they were nice and we had some plants in there, very nice people that said very nice things. So we did all that. But then there's one man who said, "It was a very good lecture, but you really didn't tell me how to deal with my anxiety." And
Mm,
you know what? That has stayed with me for 30 years. And when I developed the self-compassion and connection model that, in the my anxiety code masterclass, I solved this problem finally. I
wow.
don't know that the man still is living, but
Right.
I sure felt very satisfied that I thought, you're right, I never did. But and I knew there was an answer, and it took me that long to put all the things together. Now, that doesn't mean it's well, what does that mean? That means it's complex. And now the process looks very simple for people to deal with anxiety. And we have a remission rate of 95% when we deal with clinical anxiety, diagnosed clinical anxiety. And I'm talking getting off of medications,
Yeah. So
returning to your life, dealing with things, you're good.
basically, you're healing the trauma.
That's right. That's exactly is happening.
Okay, wait, so
Anxiety
wait,
is a
we need to,
question.
like, wait a minute.
Yeah.
All
Yeah.
this anxiety, all this that people are dealing with, to me, is just trying to keep a lid on something that is trying to bubble up inside of
Yeah.
them that they don't know how to process or deal with, which
Yes.
is the trauma that their body experienced. Mary, why
Yes.
don't that is so important, everybody. I hope you all get that. And
Yes.
why is it that our medical model doesn't fully recognize or understand how trauma impacts us?
Okay. And then after that, we're doing world peace. Is that where we're
Yeah.
going with this? Sorry, I couldn't leave that one
I
there.
love it. I know.
Just
It's
you
I'm
just teed that up here. Okay. And I know it's an
I'm
earnest question.
I am asking it
It's
out of desperation because I just
absolutely.
you know what I mean?
I'm
And
with you there.
I don't
I
expect
do. And
answer,
I just wanted to have
but
a little fun with
yeah.
this because it was like, okay, then what do I have to figure out? Thanks.
Oh my
All
god,
right.
Mary, I knew
So,
we
all right.
were on the same wavelength. I love it. I love it, I love it.
Okay. It's a multi-pronged answer. It's a great question. I think number one is awareness. And
Yes.
it, and so I think we don't understand that as physicians and providers. That's one thing. Number two, because I gave a lecture last fall at a medical school that shall remain unnamed about ACE scores
Yeah.
and trauma, early childhood trauma. The medical students had no clue.
Okay, just to clarify for those listening in, ACE scores is adverse childhood events, which
Yeah,
the higher the ACE score people have from experiencing more of these adverse events, the higher their or the worse their health is. Correct?
right. That's
Yeah.
correct. Yeah, more likely towards chronic disease and
Yes.
actually dying prematurely.
Mm,
And then, they translate that into dollars in the healthcare system, the burden on the healthcare system. And we see higher amounts of anxiety, higher amounts of depression, higher amounts of diabetes, higher amounts of, well, actually, really even early pregnancies and premature pregnancies and a variety of things. And
Yeah.
there's certainly social determinants of health that go in there too, things that folks have access to, cycles of poverty, generational poverty. It's a very complex answer. But to get to take that piece of anxiety and why don't we deal with that well is because I think it's because we've come to see it as a diagnosis and a disease
Mhm.
instead of a request for more information.
Yeah. Yeah.
Anxiety is just saying, hey, I need to make a decision. I don't know if it's safe or if I am safe, what the next step is, and I need more info. And so, that's why I say, are you sure about that? Well, what if we do it? Are you sure? Are you sure? You're just, and so if we live out of the majority of our time from the unconscious or the subconscious, that's screaming. And you're right, we've got the lid on it and we're trying to just do things one after the other. What are we doing? We're doing things over and over again, OCD. We're we are helicoptering over our loved ones
Mhm.
because we aren't sure they're going to do it right.
We're trying to
And we're
control everything.
You're right. That's exactly. And we're being perfectionists because what we can control is that rather than learning to be uncomfortable with
Yeah.
uncertainty
Yes.
because we don't feel safe. So if we look at that combination, and that's what my masterclass on my anxiety code does, it looks at anxiety as a symptom, as a request for more information. I teach you how the body is flooded with emotions from the bottom up because of all of our receptors everywhere,
Mhm.
which for a variety of reasons are called chakras, and our soul that's inner and outer and outer and inner and all that and all how we feel things, and it floods the midbrain and gets stuck. So the frontal cortex, which is the checkbox, please do it this way, please consider that process, can't come online because it's flooded up. So the process that I use with adjusting the neurology in your body allows that midbrain process to quiet.
Mm.
It allows the pathways that come flooding up because the heart has more pathways going up to the brain than from the brain to the heart. The heart
Oh.
has its own neurology. The heart has its own endocrinology. The heart is an endocrine organ. The uterus, that will be somewhere to go for all of you OB-GYNers, right? Is
Yeah.
literally a transducer
Oh,
of energy and of messages and hormones.
all right. I want to tab that because we're going to do a whole nother podcast just on that, Mary. Okay.
Okay.
Yeah.
All right.
Because I also know the stomach also has its own system
Mhm.
and producing serotonin and lots going on in our body than what we're aware of.
So we could say the current medical model might be backwards, where things are in your head, what's wrong with your head?
Yeah.
And so we've made a reductionistic, mechanistic approach to anxiety. It's all brain chemistry. It's not.
No, no.
So it's feelings, it's emotions, backstory, behavior, biography, biology. It's how do we approach what are our traumatic events, what are our resources, what's our resiliency, what is our nutritional status, what is our safety,
Yeah.
and we bring those things together to understand that we're really just looking for more information.
Yeah.
Doctors don't think that way because we're not taught that way. We're taught a certain medical.
And they have 7 minutes with their clients, our patients. So
Right.
they can't dive into it, Mary. They don't have the time to dive into
They
it.
don't.
Yeah.
And I maintain that people become physicians because deep down inside somewhere they're really truly a healer.
Ah,
They
yes.
do.
Yes, I agree. I agree.
And, and there's just no way on earth that you would put yourself through that type of training and the things that you're exposed to purely out of ego, unless you're an extreme narcissist.
Which we
And there
know we
are
have
those.
those.
Yeah, yeah, there are those.
Yeah,
But really, when you're because you just couldn't, it's hard enough to exist in that world as a physician because of how strenuous it is.
yeah,
And, and people talk, so then, people talk about, gosh, training as a physician is traumatizing, and,
uh-huh,
we should coddle the residents, and we should give them, banker's hours. Nothing to the bankers, but I'm just saying banker's hours look like 10 in the morning till 4 in the afternoons because they need time off. No, you don't see what you need to see if you did that. You need those long hours. You need to develop that ability to see, recognize patterns. I've just seen 10 normals. That doesn't look normal when I'm looking at that,
mhm,
and then you learn and you're like, okay, now what do I do? Right. And in response to things that you do in the middle of the night, you need to be able to think like that as a physician
yeah,
because people's lives depend on it. What we have now is, well, yeah, you've got a few symptoms. I guess we could do that, this test or that test. What would you like? Like, smorgasbord. Why are they deciding? They're the patient. The
right,
physician needs to guide them.
yeah,
Yeah.
yeah.
And so that makes this just so I think a lot of this is at a crossroads. And I think people that are going to be in connection with themselves are the
Mhm.
ones that are seeking out different ways to get care.
That is so important, what you just said there. People who are willing to connect to themselves
Mm,
are gonna find their way.
right.
That is so important, and that's
Yeah.
where that's our inner truth is going
Hmm.
to guide us, just like it
Hmm.
did with you, just like it has done with me, and I think the medical system keeps you away from that,
Yes, it does. Yeah.
and and so this is where, I see practitioners who are so stuck and focused in on the research and are only gonna
Hmm.
do what the research tells them to do.
Hmm.
But yet that's keeping themselves away from their own inner knowingness, their own intuition, and really
Hmm.
connecting because we have to connect with ourselves fully to get
Hmm.
that inner knowingness, to get those hits, as I like to call them.
Yeah,
And if we're stuck counting on something outside of ourselves, then we'll never connect into that.
that's right. Yeah, that's an external locus of control.
Yes. Yes. Oh my gosh. Wow, Mary, we could talk for hours and hours
Yeah.
and hours, and
Yeah.
so I definitely wanna have you back on because I
Okay.
wanna talk more about the uterus and all this fun stuff about our body, which I know you have so many more beautiful ahas about our body and how it works. Can you tell us a
Yeah.
little bit more? You've mentioned it several times in this episode about your anxiety code
Yeah.
masterclass. Tell us more.
Yeah.
Is it for anybody? Is it for
It
practitioners?
is.
What will we learn?
It's free. So that's probably the best news of the day.
It's
It's
free?
free. It's free because it's that important. People say, well, you didn't invest in it. Well, actually, 30 years I invested in it. And this is just like the culmination of that. So it's about a 45-minute webinar. You go to my website, drmarylauder.com, just my name, drmarylauder.com. And then you find courses. And then on the courses, you just select my anxiety code. And you'll be opened up to this 45-minute video webinar explaining all the things we just talked about anxiety.
Okay.
And then you get to learn the self-compassion and connection protocol,
Mm,
which you can do on yourself because people do tapping on themselves and
yeah,
things like that, which is great. But this works differently, but similarly. We're
okay.
still in that energetic psychology world, but it's something you can do. You can't harm yourself, you can't get hurt, you know, so it's all good. And
Yeah.
then if people are curious and want more, they can contact me through the office. We can go through a coaching seminar with that, or, if you're interested in telemedicine, telehealth, or coming to see me in Holland, great, all the above, but I do a lot of stuff virtually as well. And what I know for sure is we get clarity with the diagnosis, clarity with treatment options, and connection back to self.
Oh,
So
it
that
makes me
happens.
wanna cry. It makes me like, oh, yes, 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 please. Like,
Yes.
that is what is so needed, Mary. We need more, way, way, way more people practicing like you do. Oh my
Yes.
goodness.
Yeah, and that's now my mission. So clinical practice a bit and then teaching and bringing this message wider. So an opportunity to speak with you today is absolutely wonderful. Wonderful.
Oh,
Thank
I
you.
I have several people that I'm gonna reach out to that I'm like, "You need to listen to this episode, please."
Yes.
Oh,
Yes.
so important. Wow, Mary, you are such a gift, and I am so grateful that you took the time to be on this podcast and sharing your wisdom with us today. Thank you.
Yes.
Thank you.
You're
Thank you.
very welcome. Happy to be here and share in all of it. Thank you.
Oh my gosh. I knew we were kindred spirits. I knew it when I listened to
Yes.
your podcast, and this just totally confirmed it. So thank you. And we will definitely have you back on again. So thank you.
Okay.
Yay. So thank you everybody
Yay.
for listening in, and we will see you all on the next episode. Here is to smoother births and faster recoveries. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.